Here, good. So, welcome everyone. Good to see you all online. You know how these webinars are run normally, but I'm just gonna remember you that we have simultaneous interpretation from English to French and Spanish. So make sure to be on the right channel. You can choose the channel under interpretation icon. It's on the glove icon at the bottom bar. And we obviously encourage you to participate in the discussion. You know that you can raise your hand, you can activate your mic during the Q&A and open discussion spaces. And with that, the topic today we will be discussing the importance of caring for caregivers, looking at some of the existing parameters or frameworks for integrating this into our organizations, and also some of the strategies that can be implemented to address vicarious trauma, prevention of burnout for professionals who work with torture survivors. And for that, we have today with us Carla Uriarte from ICRC, Liyam Eloul from CVT, Sana Hamzeh from Restart, Mechthild, who's a former head of the Ambulant sector at ÜBERLEBEN, and they will be sharing their experiences and hopefully prompt a good discussion ahead today. But with that said, I will hand it out to Lisa Henry, our Secretary General.
Thanks a lot. Thank you. And thanks everyone for joining. It's such a pleasure always to see from our membership of 164 organizations in 76 countries around the world, people who prioritize this meeting. And this webinar, as we remember, is called Hard Work. Now, we don't doubt that all of you are doing hard work all the time, but it's care for caregivers is the theme. And it's very much driven by a request from many members in IRCT to focus on this topic. And you would maybe ask the question, why? Well, I think most of us understand what the theme that we're working with is pretty challenging. The people that we're supporting are in great difficulty. The organizations that we are working with are also challenged by a variety of things. The situation, keeping staff healthy and sane and professionally able to do their job. The funding channel that has to come in order for us to provide, right? The foundation on which we can work and serve torture survivors around the world. The feeling of empathy that we have for each other. As leaders, we want to make sure our teams are okay. But are they okay, right? Do they have the support that they need in the way that they need it at the right time and consistently? So not just a one-off staff retreat, but a consistent support over time. So we can have a team that actually delivers to survivors what they have a right to receive, which is excellent rehabilitation work of a high quality from a caregiver who knows the work. So that's the theme for today. And we're really pleased. You know, Carla, thank you very much from ICRC joining us as an organizational psychologist. So we'll hear the organizational perspective, because this is not just about a team and a leader of a team, but it's also about the organization, how it's structured, what the governance thinks about this theme, right? Are they putting emphasis behind it? Are they putting funding behind it? We're also looking for some information from Minnesota. I know CBT and Liyam, thanks very much for joining us from Minnesota, have worked on this theme for years and also trained organizations in the field. So we have experts with us, Sana, of course, and Mechthild. We have people who really work with this, also develop their own methodologies and organizational handbooks, guidelines. So here you have the people that really know this from the inside out. And as always, the question and the floors are yours. This is member driven. That's why we took up the theme. And it is in our global standards, standard number 12. So in the global standards, when we look at standard 12, which is care for staff, this is where we're asking all the organizations in our membership to actually unpack this, take responsibility for this, and work with your staff on this so that we can prevent burnout, we can ensure that survivors get the best care possible, and we can assure that, be sure that professionals are enjoying their work and have the skills and resources behind them to be able to do that. and not feel inadequate or frustrated or tired out or burnt out. So with those words, I'm going to hand it over to our first speaker, and that is Carla. Again, really pleased to have you with us, Carla. And the floor is yours. Thanks.
Thank you very much, Lisa, and thank you, everyone. I'm very humbled to have been invited and really admire the work you do. The reason why I started working in this field, I'm a clinical and social psychologist by background, and my first field experience was in Kosovo in 1999. And I remember meeting an interpreter who was she was interpreting with human rights activists that was taking testimonies of torture survivors. And just the impact on this interpreter shocked me so much. I had never thought of it before. And since then, I've realized just how critical it is that we take this seriously and we take care of ourselves and our teams if we engage in this work. Because like you were saying, Lisa, if we're not sane, how can we help others regain their health and their sanity in the horrors they've lived? So thank you for the invitation. I could speak hours about this because I'm very passionate, but I won't. I have 20 minutes and I really would like us to have a discussion. So I'll start with my aim today was to share with you really more tools that I have found interesting and important, and not so much. So I also think it's important that I explain the context of my work. So I am in the International Committee of the Red Cross. We are part of the Red Cross, Red Crescent movement, and I've seen already that we have some colleagues from some of the Red Cross around the world. So I'm an organizational psychologist working in a staff health unit, and that's inside a people and culture department. I'm very aware that our organization might be very different from yours. This is why I'm hoping that we can have a conversation where you can adapt what I will say and that it resonates for you. So basically, ICRC is a very big organization, around 20,000 people in more than 100 places and working in very different contexts. With those doing more diplomatic and high-level diplomacy work, and those really at the working with the weapon bearers, with the victims of violence and war and conflict, including, of course, torture victims, but not only. So doing protection and assistance work in the field. This is to explain where I am coming from. As I was saying, I'm a clinical and social psychologist. I'm Spanish in my nationality, and I will try to speak slowly so that the interpreters can follow up. I'll start just by, you were asking why should we care, Lisa? So we did a survey amongst our staff in 2020. We had a 36% participation rate, around 6,000 plus colleagues replied, which is, at the time, it was the biggest humanitarian sample. And on the one hand, we saw, yes, humanitarians and the ICRC, specifically the exposure to potentially traumatic events is high, not only because of the work, but also because of the lives. For those of you that are from the communities where you work or that are living next to those communities, you were mentioning Gaza, so no more to say, but so many places around the world, unfortunately, Sudan, Ukraine, etc. There's this combination between of the extra exposure you get because of your work, plus what you already live because you're in that context. Sexual violence is a problem in all organizations, and it doesn't exclude humanitarians. So we also could see that 12% of our staff had been exposed to either sexual harassment, understanding that continuum, or it was 5% who had suffered sexual violence inside or outside of work in the last year. But again, if you have suffered rape or sexual harassment and then you show up to do the type of work you do, this is something that I think we sometimes are not aware of. And then what we saw is that around 30% of our staff have screened positive for at least one mental health condition. this data is very similar to that of other studies done with humanitarians. And there was 10% of the colleagues that actually screened positive for at least 3 or more. So we say screen positive because we use scales. They're not clinical interviews, but it's an indication that those colleagues should be having at least a clinical interview to assess. There's certainly distrust. What we also wanted to look is at what are the, so we used a tool that is called the COPSOC3, and it looks at the psychosocial risk factors in the workplace, what is a protector and what is helping or protecting mental health at work and what is not. So the things that we need to decrease, high work demands, working overtime, and I'll show you now another slide because I think it's interesting to see that actually the workplace aspects are as important as the exposure. When you look at this, this is the result of odds ratio of those that rated high, so high work-life conflict, they were 2.7 more at risk of secondary traumatic stress or 1.9 more at risk of PTSD. And I think this is an important point to take home, that the way it's not only the exposure, is does the organization have your back? And do you have a condition in the workplace that you can recover from what you're doing? So you can see there, of course, high insecurity, low possibilities. You can also bullying, sexual harassment, and how that is related to anxiety, burnout, depression. The other reason why we really have to look at the workplace factors is because we can manage them. We cannot control what is happening in the conflict or in the war around us, or the stories that the clients that we support bring. This is part of the exposure that is very difficult to mitigate, but you can, as an organization, as a manager, as a team, you can improve the workplace conditions. So there's an element of control. What I'm going to do today is share with you.
Carla,
Yes.
just one second, because
Please.
I think I am sharing your presentation because you weren't sharing the screen at the beginning, but I'm not sure if you prefer to share it yourself.
Oh, sorry, because I thought I was sharing.
Yeah, I didn't want to interrupt you, and you started.
No, it's perfect.
Yeah.
So okay, as you want. I'm happy if you keep it. Berta, I thought I was sharing. It's a bit strange that it's not.
Yeah, that was me until now.
Okay.
But I thought.
So what do you suggest I do?
I think maybe you can take over, because then you can switch from one slide to the other.
Is that? Can you see my screen now?
That's now. Yeah. Now it's perfect.
Perfect. Sorry for that.
Perfecto.
Great. So what I thought today is that I'll share the tools that we have found interesting and useful as guidance, because it's easier for you to adapt to your context. So this is the WHO 2023. They published this mental health at work policy brief. There is also some guidelines, very practical, very useful, very evidence-based. And I really like this because what they propose is that the strategies to address mental health at work are prevent, protect, support. Afaf, I see you have your hand up. Would you like to come in?
Afaf Malak, can you hear us? Or we have Andres.
Yeah. Hello for everybody.
Una pregunta. Una pregunta.
Sí.
A nivel de la prevención, ¿se menciona el análisis propio de la persona? ¿El autoconocimiento?
Sí. Sí, voy a explicar ahora un poco los 3 niveles. Gracias, Andrés. So Andrés was asking me if at the level of prevention, is the self-awareness of the capacity to have self-awareness. Is this part of it? And indeed, very important. And there's the WHO, they put it more in the protect and promote good mental health, and self-awareness is part of it. So what I will do is I'll go quickly into giving examples of each one. And what I would actually like to do is ask you, how does this resonate? How is this applicable to you? So we're going to look at the prevent, which is really more these workplace factors, like workload, work-life balance, and we'll go in a moment. The protect and promote, it is about building this capacity for self-awareness, for emotional regulation, for anything that has to do with promoting the good mental health. And then the support when we are not well, and this happens, and it happens a lot more frequent than I think we are aware. How does the organization support the recovery and the support? So I propose we move to the each one of them, because this is where I wanted to ask you to explain, maybe in the chat, or you can open your mic. How would you do this in your environment? So let's start with the prevent, the work-related mental health conditions. How can we influence the environment? So two things that we've learned is leadership awareness and commitment is very important, having conversations of why should you care? And the other one is that managers and team members have discussions around this. So this is what some of the aspects. So here you can see aspects of the work: job content, workload, the schedule, job control, the environment, the organizational culture. Sometimes too often I see colleagues that are more hurt because of the lack of supportive relationship in the workplace than actually from the exposure to potentially traumatic events. So I'll stop here and ask you, could you write in the chats if you recognize any of this list of aspects of works as a especially important element for you? Which one would you say? Is it workload? Is it work schedule? Either as a protector, because you feel that you have a very good workload and this is protecting you, or as a risk, a hazard, because it is, maybe you can say, my interpersonal relationships protect me, or you can think my interpersonal relationships are putting me more at risk. So it's a good moment for you to stop and have a look. I'd be happy to see if someone wants to share in the chat, or you can open your mic. We will get one and then move to the next. I might need help, Berta, because I don't see the chat.
Yeah,
while I am
you don't see the
presenting.
chat. I can guide you there. So
Thank
Liyam
you.
is sharing, I think workload is a huge risk factor we run into in our work because funding is never sufficient to be fully staffed to meet the need. Sara is sharing workload, environment, and organizational culture. Clarissa, carga laboral, so workload. Alice, risk, workload. And I think some more people are writing. Martina, short deadlines, understaffing as risks, lack of control over job design and workload. Good.
So workload seems to
share?
be a big point.
The big one. Miriam, she's sharing vicarious trauma and workload. Paola, the most difficult to manage is the workload. Cajo, I believe culture and job control are important to promote resilience, but the other factors are needed to prevent and support. Colbasia is sharing also workload. Well, he's reflecting that he's hearing a lot about workload. Sara is also adding communication style with multicultural teams.
Yeah, interrelationships. So
FRC, Sri Lanka, workload, organizational culture, workload again, and lack of clarity on the role in the organization. definitely
Okay.
workload. Yeah.
Interesting.
Mm.
So it seems you have there a common theme. We won't go too much into it now, but this is a conversation to be had. This is when you identify, and this is really the invitation, is when you don't have resources, because I understand that you might not have the possibility to have occupational health experts, but it really is as simple as committing with your team and maybe with yourself to stop and realize and acknowledge there is a workload. Let's put workload because it's the one that's come more. What can we do? Because there are things that can be done. And secondary traumatic stress and workload are very related. If you're seeing all of these different difficult cases you're managing, and you cannot take a step back and breathe and study it and consult with others and just give yourself that buffer, it's going to increase the risk. So that's one of what that was just I'm only showing like small examples. And again, you have the guide. I think this is then my invitation is that you can take it up on yourself.
And Carla, I actually
Yes.
want to bring in also the perspective from Hadar. He's mentioning training on safety measures, capacity building, absorption phenomenon, labor rights protection, and then Martina reflects on the flexibility at work. She says flexible working arrangements are organizational interventions that mean a lot and really good interpersonal relationships at work.
Exactly, very protective factor. If especially also if you feel that your boss or your colleagues have your back, it really can make a big difference. So talking about training, and of course what you were saying, Lisa, at the beginning is critical, so that the people you serve are served by professionals that are well trained, but technical training will protect you in the face of difficult cases. Now, there's other elements, and what the WHO is proposing is the manager's training for mental health. I'm going to share in the chat when I finish. Within the Red Crescent movement, we've developed an e-learning. It's 1 hour. It's very practical for managers, and it really is at least an awareness raising of some of the situations and some of the things that they can do. So I'll share that just as an example. I know WHO is working on a training package for managers worldwide, so that should be available, because it is really this idea that your manager has your back and understands you and can. Good people management is so protective. But then there's the element that you were saying, Andres, about also improving the understanding of ourselves as individuals. First, we have a responsibility for our mental health. So if we want to be responsible for others' health, we have to be responsible for our mental health. And there are things, and I think the other speakers in today's session will go up on this more. So I won't dwell in it, because I think we'll hear good examples. And then, yes, anything that has to do with building personal resilience. And of course, we all know that the first step is awareness, self-awareness of our limits, self-awareness of our resources, and really investing in those. But I won't go too much into that anymore. Now, the final part is the people that have mental health conditions receive supports. And this is where I think sometimes it gets tricky, because there's so much stigma, even amongst us that work with people affected by trauma or torture, that we are, even amongst health professionals, recognizing when it is us that need helps, and being able to say it in the workplace, and being able to say it in a way that it's safe, because then whoever you tell not only can hear it without judging, but also knows how to help, and there are systems for that. So an organizational intervention is to make sure that where do workers go if they need mental health? And it has to be adapted to your work, because if you go to a psychologist that is not familiar with the line of work you do, they might not be picking up on the specificities of the trauma-informed on the burnout, secondary trauma. I mean, they're really related to the work and your life, of course, again, especially for those of you that work in places where the human rights violations take place or the violence is happening, it's all compounding. So I'll stop here because I think there's a lot of other interesting sharings. I just wanted to now open for a moment on, let's talk. How can you, my question would be, how can you imagine to start this conversation in your organization? Can you do that? Can you start the conversation about workplace conditions, but also workplace resources that you need? So I leave it open. Question.
Feel free to go on mic, activate your mic, raise your hand, write in the chat. Cajo is saying in the chat that he agrees the contextual understanding of the nature and limitation of work, as well as the humanitarian context, are important qualities for the mental health support at work. And Sarah, I can see you have the hand up. Feel free to unmute.
Yes, thank you. So as a frontline worker for mental health, I think that it's important to bring this conversation to the supervisions inside your teams. In the agency that I work in Canada, is a mental health. So I'm in charge of the community engagement team. We are the frontline workers that welcome clients to the services. And this is very important for us to first get excellent training for interviews, how to stop an interview, how to ask questions for the clients in order to don't get sensitive information that stays in your system and later on the stress impact that you are having. So having these conversations first in your team and then opening these conversations to your supervisors, nearest supervisors, in order to check workload, right? The increase of the numbers, how many clients you are receiving every single day, what are the specific needs, and how to split the work. Sometimes we are having more clients than workers, and this is where the overload work we all struggle from. So it is important to consider.
Thank you, Sarah. Very clearly, richly well said.
C'est tout à fait sensé ce que vous dites.
Anyone else would like to share?
Y a-t-il quelqu'un d'autre qui souhaiterait partager quelque
I
chose?
just don't know where is the raise your hand, Berta. I want to raise
Please
my
go
hand.
ahead. Go ahead.
Don't raise it, just,
Okay.
just unmute.
Please.
Okay, thank you very much, Carla. It's very important what you said. I believe that any care for caregivers program should start with the organizational structure of the institution itself. They have, for example, to develop a policy like PISA, the anti-sexual exploitation, for example. They should have a separate complaint system, which is very important so that the director or the manager will know also that other people can hear the voice of the staff.
Mhm.
In our case, for example, it's very important that the director and the immediate manager must be available also for the staff and reachable, especially when they are in a dangerous situation. And also, we offer our team every now and then. We invite experts from the Red Cross, for example, and other UN agencies who operated in high risk areas like in Darfur, in Sudan, for example, and they come and they train the team on safety measures, how to protect themselves, how to report when they are in danger, for example. So what is very important, that the idea is not only to take your staff for a retreat. It is an essential part, of course, but other means are needed as well. It's very important to train them on how to do peer-to-peer supervision, because the clinical supervisor is not always available for them, and also to offer them individual and the group settings, whatever they prefer. And whenever the organization is able to provide some special support, debriefing, or even therapy, shouldn't hesitate on that as well.
Thank you very much. And I really want to highlight two very important things you've mentioned. One is being available, creating the time to be available for your staff as a manager, and then the listening and adapt. Because I think that sometimes not done enough, in that we assume that what people need is this. So you tell me you have a high workload, and I assume that I will solve it this way. But actually, a key element is participation, listening to the staff, asking, and giving them also this agency, no? And this element of control, regaining the control and adapting to their needs. Thank you very much. I don't know if, Berta, we have a bit more time, or we move on? Because there's so many other interesting, fantastic.
Yeah,
thank you,
we
everyone.
need to move on, but thank you so much, Carla, for the presentation. And if you have any questions, comments, keep them, because we'll hopefully have some more space for discussion at the end. But now we'll go to Liyam Eloul. I'm not sure if I'm pronouncing it right. Liyam is a clinical advisor for mental health at CVT Minnesota, and she will be our next panelist or speaker. So Liyam.
Thank you. Yes,
Liyam. Liyam, right. Yes. I'm going to share the screen so you can guide me through the slides.
Thank you. And thank you all. It's such a pleasure to be on the panel and to be hearing the conversations that are already starting. I'm taking notes madly as I'm hearing people talk. So I'm from CVT, and I think most folks have some sense of our organization. We're a relatively, so you can go on to the next slide. Thanks so much, Petra. Kind of a mid-sized organization. We have programs in the US, but we also work internationally. Currently, our international programs are primarily in the Middle East and East Africa. And I think the piece that I want to emphasize is that our staff, as we think about staff care, our staff come from a range of training levels across our programs, depending on what's available where we're working. So from paraprofessionals, from community members from the affected communities, to folks who have undergrad or grad degrees in mental health. So when we think about resources for staff care, our staff are coming in with a variety of levels of background and training. And we believe that effective staff care, including effective self-regulation, is a foundation of trauma-informed care. So we have a real emphasis on supervision with a heavy staff care component, as well as capacity development in self-care. And I'm going to talk a little bit specifically about, so you can move on to the next slide, please, Berta, about our staff care system for our programs in Northern Ethiopia. So we can move on. Thank you. We try and build this in at a variety of different levels. So from onboarding, where we're doing quite a bit of psychoeducation on the impact of trauma for admin staff as well as clinical staff. I think admin staff often get forgotten. Our monitoring and evaluation staff, interpreters were mentioned, all of these staff that end up having exposure that aren't in the front of folks' minds and that often actually have less training because they don't have the clinical background to manage what they're being exposed to. So we also do regular workshops on self-regulation and self-care techniques. We have a staff-run self-care committee with a budget to organize activities, and including monthly team building activities. So in the last presentation, we were really talking about the importance of those good team relationships and the felt support on your teams. And for our teams who work in remote areas away from their families, that team health is really core to their well-being. And then Sarah was highlighting this in the chat, but for staff from the affected communities, there's a real both strength and a vulnerability in terms of their awareness of the like felt awareness and experiential awareness of the pain that our clients are going through. So we have additional individual staff care sessions that are available to them, as well as group support on a regular basis. So we can move on to the next slide. In Carla's presentation, we talked about awareness, and Andreas, you highlighted this as well. That awareness piece is so key, both in terms of staff awareness, in terms of manager awareness, and in terms of, you know, for managers, like building the systems of support, for staff being able to tell when you want to use your self-care coping mechanisms. So because we have staff with a range of training, we use the ProQual. So clinical staff might have a sensitivity and relatively good self-awareness, but for a lot of folks who are coming into this new, especially depending on the cultural background and how much attention there is to your emotional state, how much space there is to talk about that, using a structured tool can be helpful. It doesn't work in all locations, but I'm going to talk a little bit about how we used it in with this Ethiopia team. So the ProQual is meant to be a self-administered self-reflection tool to track your well-being. And in Ethiopia, the clinical staff would take it quarterly at least. Interpreters were included in the clinical team, and they had a choice to share the results or significant changes in their results with their supervisor. And then all staff were taking it as a component of our staff retreats and planning sessions. The ProQual is this 30-item self-report measure that looks at both the positive and the negative aspects of caring. It's been used for over 15 years across, I think it's in 28 languages across a variety of different contexts. It's relatively easy to self-administer and score, which is one of the reasons that we were using it. And it breaks down that professional quality of life into a couple of different categories. So it looks at compassion satisfaction and that state of acting with compassion that helps you feel fulfilled and more positive about yourself and your work in the world, and compassion fatigue, where acting that state of compassion feels overwhelming and draining. And a big reason why we find this helpful is because it breaks compassion fatigue down into both burnout and secondary trauma. And the reason that breakdown is helpful is that their burnout and secondary trauma are elicited from different exposures to stress, and the symptoms are better addressed with different self-care and different staff support techniques. So being able to see what's most impacting someone is really helpful in being able to provide support or guide them in their self-care practice. So burnout is that work-related hopelessness, the feelings of inefficacy, of exhaustion, and you would address those symptoms with coping skills that help energize or engage a kind of frame shift from the workspace to a social space or to a decompression space at home. You would use either clinical or administrative supervision, help to shift tasks, workload, time off work. And that primary protection is really a reasonable workload, as we were all talking about, and recognition for the achievements, as well as regular breaks. Comparatively, secondary trauma or vicarious trauma is where the work-related exposure to trauma or traumatically stressful events results in the experiencing of traumatic symptoms in the staff, even though they may not have experienced their own trauma episode. or they may have, and it may be triggering. And this is an expected response to being present with unspeakable human suffering. It's kind of a occupational hazard of our work, and I think it's really important to present it that way because it can be perceived as a vulnerability or a weakness, but none of us is really born ready to do trauma work. We all need ongoing training and support to build and maintain those muscles to keep ourselves healthy in this work and keep our baseline functioning high and our own resilience high. So coping skills for vicarious trauma or secondary trauma are more targeted to self-regulation and symptom management. And when you look at it from a management perspective, thinking about breaks from work that include the exposure and creating that space for self-regulation. And also that developing of a sense of empowerment and meaning in life and work, kind of connected with how we would treat trauma and that connection to sense of meaning that comes through post-traumatic growth. So I think we can change slide.
And Liyam, you let me know when you had planned to fill out the survey. Yeah.
Okay, perfect. It'll be in a little bit. So I also just want to emphasize, and this connects again to the point that Sarah made just recently, with secondary trauma, our identity really matters. So our identity, our values, our personal histories and exposures all influence our work. They also influence what we pursue in our work, that attempt to mastery and self, like the ability to take on things that we may have experienced and find meaning in that. So it's both a strength and a vulnerability. And one of the key ways to keep it a strength is that self-reflective, self-awareness component. And supervision is really key to this. So folks who are higher risk, depending on their experiences and identity characteristics, need support through that supervision space in order to self-monitor, maintain the boundaries between the client experience and their own experience, and be able to track how they're doing in any moment and do their own self-regulation practice. I highlight this so we can move to the next slide because with the start of the conflict in northern Ethiopia, there was a sudden shift in the context and in the clients we were serving. And this made a shift in the way that the identity characteristics impacted our staff. Suddenly they weren't working with refugee torture survivors, they were working with their own population. And those implicit boundaries that had previously protected them were suddenly restricted. The ability to stay neutral and was constantly challenged, and neutral in a very political conflict and an ethnic conflict was being constantly challenged. And even the close bonds within the team that had been built over 8 years of teamwork across our multi-ethnic staff was really strained. So that relational support was also, and the safety that was felt in the workplace was also strained. So once the conflict started, as this was coming up, because we had an experienced staff that was able to provide some of the feedback, we were very lucky about that. We started to adjust our approach, recognizing that the entire staff was now impacted. It wasn't just the staff that we had who were from the originally impacted community, the Eritrean community. And so the use of a new tool that we had developed called the Protocol Health was identified as something that was actually more appropriate. So you can move on to the next slide. So the Protocol Health was a tool that that we developed actually during the pandemic, and it was an expansion. It was developed kind of focused on healthcare workers in the humanitarian sector, but it was an expansion of the Protocol, and it expanded both the kind of protective and vulnerability factors that were being assessed, which meant that it was also a better fit now for our staff in Ethiopia. And the concepts that were added were moral distress. So that distress that occurs when workers are acting in a way, they have to act in a way that is contrary to their personal or professional values, and undermines their sense of personal integrity and authenticity. So, for example, with nurses in COVID who weren't able to provide medication or ventilation to everyone and had to make decisions about who was cared for and who was not. And also on the positive side, perceived support. So this individual's experience of being cared for or loved or supported, made space for in their relationships, and having a sense of being valued and needed by other people, being in a mutually supportive network and of relationships. And I just want to briefly go through the next 3 slides. Berta, if you can just flash them up. This is just the ProQual website, and I want to emphasize that there are resources. So with the funding to develop the ProQual Health, we were able to develop resources, handouts on all of these concepts, and also for the next slide on tools, some self-care tools that you can use, that staff can use. If you can go to the next slide, please, Berta. So this is just a sample of them, but they can be useful we were using them in the supervision space with our staff. Currently, those tools are available. We can go to the next slide. In a variety of languages. As we get more funding, we add as many languages as we can. Go on to the next slide. So the other components that came up were this shift in what we wanted to be talking about in supervision. All of these new concepts that were being brought into the supervision space, and really wanting to provide support and capacity guidance for our on-the-ground supervisors. So we started to develop these supervision guidance notes for the supervisors in the field, and our own supervision with those supervisors, really kind of digging into some of these issues, including moral injury, including holding anger, your own and your clients, and a sense of betrayal, feeling helpless, losing faith, losing belief in a just world, in the goodness of others, survivor's guilt, ambiguous loss, complex grief, a lot of these themes that had been lightly touched on before, but now were coming up so vibrantly from the staff. So we can go to the next slide. I don't want to focus only on the negative. The protective factors, so as we think about providing care for our caregivers, that balance between identifying the risk factors, but then really building on the resilience that's there and building on the strengths that exist, both in a tailored way for individuals, but also looking at that team as a whole and helping to build the positive relationships that exist on that team or facilitate the development of those positive relationships. You know, all of the other piece of this is that, you know, with the exposure to trauma, yes, you get exposed to things like vicarious trauma, but you're also exposed to vicarious resilience. All of our clients are survivors. All of them are now with us because they have made it through something terrible. They have survived. Now to be present in this space with us to talk about what happened. And that can't be underestimated, the power of that. And for our staff who are in the context of Ethiopia, that was really important. Both the ability to not just feel helpless and vulnerable, even though they weren't able to do much in the context of a massive conflict, they were able to do something. They weren't just sitting at home. They weren't just hiding. They were helping their community. They were engaged. They were using the skills that they had in order to contribute. And that moving past that sense of helplessness was really important. And then also being present with the resilience of the clients around them and helping to facilitate the growth of that resilience and building on those strengths was really important. So I think that that's a really key piece for all of us to maintain awareness of as we're supporting our staff. Like, how do we move to that with our staff, move to that survivor mentality and that wounded healer mentality? and the strengths that are embedded in that. So I think we can move to the next slide. And just touching on the way that the protocol can be used in resilience planning, both at an individual level, where we're tracking the fluctuations in the impact of the work on us personally. And that helps us decide where we want to put our energy in and how we want to use the resources that are available to us. Am I more in a state of burnout right now and I need to have a conversation with my supervisor about workload, or am I more in a state of vicarious trauma right now and I really need to think about how I'm managing my own arousal levels and my own self-regulation? It can be used at an organizational level if staff are willing to share their scores, ideally in an anonymous way. That can help supervisors or managers track patterns in staff well-being or vulnerability that can help the organization then tailor ways to maximize the positive aspects that exist or reduce the negative aspects of helping and address some of those organizational factors that may be creating a higher vulnerability rather than resilience. And that it can also be used in the supervision space for providing supportive supervision, helping the supervisor understand where to focus with a staff member and to track their supervisee's well-being. And we found it very helpful for this. So I want to close. We can go to the next slide, Berta. I feel like that was a marathon and I spoke probably too quickly for the interpreters. I apologize. But I want to close with a little bit of a reflection that for all of us doing this work, that attention to why we're here, why we do it, what our sense of meaning is, and how we can connect to our own resilience. So taking a moment before we move on to questions to reflect on something, a rewarding thing that happened in your work in the last month, thinking about people whose lives you've touched in your work or outside, and thinking about the lives of the survivors who have touched you, things that you've heard in your work that have touched you and have built your strength that you've carried with you. I think we
feel free to share them.
Yeah, feel free to share them either in the chat or raising your hand. I understand that they're very personal, so people might not feel ready to share, but I really think we often don't make time for this, especially with the workload issues that we were talking about. And so it's important just to make space, even personally, to do this kind of a reflection.
Sarah is sharing in the chat. I have a lot of clients that touch my life hard when I see their strengths.
Yeah, me too. Yeah.
So I want to thank you all. And I'm really looking forward to listening to Sana's presentation next. But I'm open for questions if there are any before we move on.
Thank you, Liyam. I see Heather managed to raise his hand. So feel free to go on mic, Heather.
Yes, I'm happy about that and excited. Yes. Thank you very much, Liyam, for this very interesting presentation. Under the fatigue compassion, you mentioned also the moral distress. Could you please say more about that?
Yeah, absolutely. So moral injury or moral distress was a concept that, it's been around for a long time, particularly connected to military, but it really started coming up in COVID. And it's this context where a helper So someone who has identity connected to being in this role of doing something good is then in a position where they're either unable to do something that they ethically, from their own values, believe that they should or need to do in order to help. So they're either restricted from doing that, or they're put in a position where they actively have to do something that is against their moral values or against their ethics because of the constraints of the work that they're doing. So that challenges then the identity as a helper. It challenges then your own concept of your goodness and a sense of meaning then in the work that you're doing.
Thank you very much. It's very important, actually.
I can see we have some hands up. Well, we had some hands up. I don't know what happened, but otherwise, feel free to activate your mic. And there are a couple of reflections in the chat. Carla is saying, as a technical manager of a group of psychologists supporting the humanitarians on the field, I believe I have touched their lives by being there to listen and support them in the journey. Carmen Alonso is saying, heartfelt conversation with Mr. Jones at a maximum security prison last Friday. So these are examples of how you've been touched by these experiences. Clarissa, with the Mocao adolescents or youngsters who have been who suffer from ocular trauma, that Clarissa is saying they keep teaching us how to continue fighting and resisting. Andres, you can go on mic if you have questions. I can see you're asking in the chat. Otherwise, I'll continue reading what you have in the chat.
Sí. Muy bien. Pero es más general. No quiero, porque Liyam hizo preguntas, no estoy respondiendo a las preguntas. Quería hacer observaciones por el temor que no sé cuánto tiempo tenemos. Primero, en la realidad, a nivel de los organismos de sostén, un apoyo para los profesionales no hay, ¿no? Lo que han descrito son puntos muy importantes, pero el Fondo Voluntario por Víctimas de Tortura no dan un espacio de financiamiento para esa temática. La Unión Europea tampoco. Y lo que no se pide es como si no existe. Entonces, eso es la situación básica. Ahora, ¿por qué he preguntado en particular sobre el tema del autoconocimiento? Es porque lo que he podido observar es que hay poco espacio dado si una persona se da cuenta que quisiera hacer un autoconocimiento, no está en la estructura. Por ejemplo, en un caso, nosotros, una joven psicóloga que entró en el ITI en Bolivia, le hemos pagado la mitad de su autoanálisis con una profesional fuera de la institución durante 2 años. Porque consideramos que estamos muy expuestos a situaciones difíciles donde es importante conocer sus fuerzas y sus limitaciones, si no se quiere quemar en esta situación. Pero eso no está considerado. Lo que se presentó me pareció muy importante, que la institución también plantee elementos de autoconocimiento, de autocuidado. A la vez, me parece, tendría que existir una posibilidad fuera de la institución, donde la persona, el profesional, tiene alguien de que pueda hablar de todo lo que le viene en gana. Pero eso hay que sostener. El trabajo que hacemos, los salarios no son altos, en la mayoría de los casos no son altos. Y si no hay un sostén específico, es muy difícil. Y para terminar, quería de repente se mencionó, pero no estoy seguro. Lo importante es su autoanálisis, supervisión, apoyo plenamente, pero también espacios de distancia. Y ahí hay que ser muy creativo. Esos espacios de distancia puede tener que ver con baile, puede tener con música, pero espacios donde la persona olvida por un momento el mundo en el cual está. Para ilustrar, hay una muy linda película iraní que es la historia de una familia que está huyendo los bombardeos y hay dos chiquitas, una amiga, sus padres han muerto, está con ellos. Y hay un arte de esas dos niñas, encontrarse espacios de juego impresionante. Hay bombardeos a todos, pero esas dos niñas encuentran espacios de juego, todavía poder ser niñas. Para mí es, no sé el nombre de la película, me da mucha pena, pero
Habrá que
es
buscarlo.
fantástico. Con eso termino, gracias.
Gracias, Andrés. Habrá que buscar el nombre. So with that, I think we'll actually have to move on because of timing. We'll have to move on to Sana. There were a couple of nice, good reflections in the chat. And Andres, I think Liyam was actually responding to you on the chat already. But yeah, we'll have to move on to Sana. Sana Hamzeh. She's a psychologist, clinical advisor, and psychotherapist at the Restart Center in Lebanon. So Sana, the floor is yours, and feel free to share your screen. And again,
Thank you so much, Berta. Thank you so much. Yalla, I share my screen.
Yes, maybe you
Hello,
can.
everyone.
Maybe you can put full screen.
It's okay. Hello, everyone. I would like to thank you, Berta, and thank ICRC for giving me the chance to talk about the importance of self-care by describing the Care for Caregivers program that we have developed and implemented in Restart since 1996 till date, and what to do to cope with stress. I'm not going to talk about one technique. I will tackle many techniques and give some tips about self-care. So, take care of yourself so you have space to take care for others. Self-care is not selfish. It's an act of self-growth and self-preservation that you must actively learn to prioritize. Self-care is giving the world the best of you instead of what's left on you. It's help you move from existing to living. It's your choice to do, live or exist. Who is prone to burnout? Me, I'm prone to burnout. My colleagues also are prone to burnout. I think most of people working with victims of torture and in the conflict zone are prone to burnout. Some of attendees maybe are prone to burnout. You can tell me if you are prone to burnout or no. Maybe even presenters are prone to burnout. So, to be honest, to avoid the burnout, it's not easy at all. Our work can be stressful. So, can you relate to any of these pictures? If you relate, please raise your hand by pushing the icon, zone icon, hand zone icon. Chat, I will see. Can you relate of all? I cannot see.
There
Nobody.
are a lot of hands up, Sana. Alice Porter, Liyam,
A
Carla.
lot of hands. I'm happy to see you, Liyam. Anyway, it has been a long time. Yeah. So great. I'm not only in this case. You let me feel not lonely. It's great, really. I cannot move to another slide. Yeah. Why is self-care is so important? Stress impacts us in many issues, in many ways, whether through mood swings or and anger, or through bodily symptoms, somatization, and difficulty in focusing. Source of care for caregivers cases. The sources may be numerous. I will mention some of them. For example, frequent exposure to complex cases such as torture, which may lead to vicarious trauma. To be honest, I will tell you something. Working with torture and trauma survivor has really changed me. Sarah Lopez talked already about her her beneficiary impact on her. Torture survivors would often say, "I'm not the same anymore." Me, working with these people, I feel that I realize that I'm not the same anymore. My colleagues also always mention they are not the same anymore. And maybe some of you are not the same anymore. To be honest, I am a new version made by my life experience and my work experience, and made also by stories of our survivors. In addition to this, feeling that our work is unrecognized. I am 60 years old. I need recognition. So what about young professionals? Toxic relationships, the difficult boss, or the angry, unsatisfied, and aggressive client, all those increase stress and decrease motivation, leading to professional burnout. As you can see here, we start by having physical pain, then we are feeling totally exhausted, then our performance is dipping down and down, then we stop putting effort in our work, and the final one, the last one, is we don't feel excited for work anymore. And if you work without passion, it's for me like a punishment. There is sign. What are the signs of warning? What are the warning signs of burnout? This sign can be physical, such as pain, weight gain, and feeling tired. Headache, always we say, I have headache, I don't know why. I have somatic, I don't know why. I have pain, back pain, leg pain, etc. Emotional, such as anxiety, depression, self-blame, self-criticism. Negative self-talk. Cognitive, such as inability to concentrate, inability to think straight, dissociation, or behavioral, such as anger outbursts, avoidance, numbness, drugs, and alcohol use. If we keep racing against time to finish things without finding a little time to pause during the day, we will almost reach the stage of burnout. Is the PTSD and the burnout are similar? I ask you, is it similar? Can you say to me if it's yes or no? They are similar, PTSD and burnout? Let me know, Berta, if they raise their hand or no.
Yeah, or if there's something in the chat. Right now I can see some nodding from Sarah and some no from Liyam. So different opinions.
Different opinion, yes? Okay.
They can go on mic maybe to expand or...
Like, to be honest, some people believe that burnout is a form of PTSD. Looking at the characteristics of PTSD, I think we can check each item for burnout. For example, if I have trauma, if I pass by a trauma, for example, event, for sure, I feel sad, I have hopelessness, I couldn't sleep very well, maybe I can see nightmares. They are so similar. There is a similarity between burnout and PTSD. That's why we have to take care of ourselves in order to prevent ourselves to get PTSD because of work.
There is some reflections in the...
This is what we call therapeutic window. Balancing workload, understanding the types of windows you can open in therapeutic work is crucial. This include windows of empathy, trust, communication, and insight. It's essential to find a balance when and how setting limits, maintaining clear boundaries, practicing self-care, finding the right balance to maintain our well-being and to ensure an effective therapeutic process to our client. We should learn to say no, to provide ourselves from storm, as you can see in the picture. Paulo Coelho says, when you say yes to others, make sure you are not saying no to yourself. Saying no, it's a magical word, but we have to know when we say no. It's really a magical word. It releases us. Stress can have an impact on caregivers during a session. We may feel tired, react impulsively, avoiding certain questions, asking especially about details of trauma, procrastination. It's over-involvement or over-distancing. It's a beginning of our fatigue, which leading to burnout. You know, when I get tired, when I am affected, I am not the only one who is affected. My colleagues also are affected. The whole center is affected. The burnout is contagious. It's burned the whole center, it's the whole association. There are several tests that can assess the extent to which healthcare professionals are affected by work-related stress, like Maslach tests. Already, Liyam talked about Procol tests, which is very good to measure compassion, satisfaction, burnout, and secondary trauma. I don't want to mention more because already Liyam covered this topic. Stress may additionally impact caregivers after session. The boundaries between personal and professional may become blurred. We may find it challenging to focus on anything that's not relating to our work. We might find difficult to talk with people, even our beloved one, for example, talking with friends or family. We avoid to go out. Always we say, I'd love to, but you know, I've had a very exhausting day in my work. Maybe next time, maybe next day, maybe next month, and maybe next year. Why? We neglect our well-being at this point. Why? We make a lot of procrastination to take care of ourselves. We become, our moods may become, for example, unstable. We may feel tired, find it difficult to sleep, or may have nightmare, over-identification. All this reaction may lead to burnout, then inability for job performance. We have to take care about countertransference. Also, I think Mechthild will be talking about this issue. We have to know our position as psychotherapists, as professional, and the position of our beneficiary, our victims. You have to know you are the spine, the colonne vertébrale. We say colonne vertébrale in French. If you failed, the patient cannot have access to rehabilitation, then the center will be failed. Then I will let you know that honestly, with time, I say, go, bye-bye. You lose your work, really. That's why you should focus on your work. You should, we have, we should be aware about our counter-transference in order to not become drama triangle victim. Also, drama triangle victim, where everyone become a victim, there is three roles like this is illustrate a power of game that involves three roles: victim, rescuer, and persecutor. We don't have control over other people, but we have control over ourselves. So if we can move from blamer, persecutor, to challenger, and from rescuer to coach, and victim to survivors, we can switch to dynamic triangle by creating a safe setting where individuals can express their feeling freely without being judged. This is drama triangle. It's important to ask for help, to go and talk, to not feel alone, to debrief in order to decrease burnout. It's necessary to find a balance between caring for others and caring for ourselves. By caring for ourselves and our pain, we may become more confident and more efficient. The aim of Restart Center for Care for Caregivers. This program was developed gradually over the past 28 years. It is tailored toward our teams and clients' priority and needs by tackling several objectives, such as enhancing team cohesion and productivity and relieving work-related stress. We try to run the work atmosphere positive as much as we can. Restart Center developed also a manual on care for caregivers as a step-by-step practical guide to assist us and other organizations in implementing similar intervention with their teams, like steps related to psychological debriefing, clinical supervision, strengths-based intervention, self-hypnosis, and other strategies are outlined. I think most of you know about this manual, and it's online, I think, also. Carmen, you can say if it's online and how we can access to it. Thank you. Here are some pictures of care for caregiver sessions that we were conducted with our team. The system approach of supervision, or SAS model, which developed by Dr. Johan Lensen and Dr. Tom Hans, is based on case group supervision and peer supervision principles. Through peer feedback, clinicians can develop a more comprehensive understanding of the client. The group usually consists of individuals from different professions with different levels of experience, such as psychologists, social workers, nurses, psychiatrists, neurologists, etc. I have been attended this, the first one was Khadr. Khadr was also with me. Do you remember Khadr, about this? And I had a trauma when attending this because I talk about patient and I feel the exposure, the same trauma event, if you remember. So from 2009 till now, we have been implementing the SAS model with our team at Restart. This is for sure decrease burnout and increase confidence. Care for Caregivers program at Restart, also several team members are trained on implementing Care for Caregivers activity to frontline. We provide we have been implementing this activity internally within our team and externally with frontliners from other NGOs. Here you can see in the left the relaxation session done by senior physiotherapist, and in the right, like not Zoma, it's yoga session. It has been done near the sea with very good atmosphere. to let people go out and far and this to make distance between their work and the place where they went. Also, we have make a lot of Zumba, which they make a lot of energy, physical energy, and also dream catcher. We can apply also this dream catcher with group, children group who suffered especially from nightmares. Debriefing session involves debriefing session. We can express traumatic events like in our mind. It's a form of emotional discharge. It's a form. You can see here the debriefing session. It's out of the center. We take distance from the center to talk freely about our emotions. Also, the debriefing is not a therapy for trauma and PTSD, but it can decrease the impact of trauma after the session. A debriefing session, for sure, we need to talk and to express our traumatic memories stored in our mind. And a debriefing session involves 4 key: stating the fact, for example, Beirut blasts, for example, Gaza situation, for example, North Lebanon situation, or Ukraine situation. Then we talk about emotions, about our feeling, how we can support each other and share our feeling and support each other. Then normalization and validation, and finally providing hope and assigning the date of the next follow-up session, which will be after 3 weeks. Self-care is a priority and necessity, not a luxury in the work that we do. Never. It's necessity. So, as most of you know, emotional stress reaction are normal reaction to abnormal situation. There is a daily checklist we can use with ourselves, with ourselves. For example, this daily, how am I feeling today? To be honest, I feel a little bit stressed about my presentation. What I am grateful for today. Gratefulness helps us recognize all the things we have to be thankful for. I am grateful for being with you. I am thankful for your attention. Think about all good things you have in life. Many research studies have shown that gratitude is associated with greater happiness. So cultivate gratitude. What do I need to do today? Think about this. Everybody think alone. And I tell myself what I do. I feel that I like to be surrounded by happy and vibrant friends. What do I want to accomplish today? I would like to accomplish this presentation, to feel free, okay? Then after the last one, what's something I can do today that would be good for myself? Leisure. Leisure activities can be a wonderful way to relieve stress. Yet many people feel like their lives are too busy for hobbies, games, or extra fun. But building time for leisure into your schedule could be key to helping you feel your best. And when you feel better, you perform better, which means, as you see here, leisure time may make your work time more efficient. The self-care time. Take the time today, 28th of February, to love yourself. You deserve it. As I mentioned before, self-care is not selfish. It's not selfish, but self-care is giving the world the best of you instead of what's left on you. Now, develop your self-care plan. An effective self-care plan should be tailored to your life and your needs. It needs to be something created by you, and for you. Some people, for example, give me a present during my university to go make a session of massage. This is like a punishment for me. I don't like to do massage. I like to do something else. I have to create my self-care. It's in my comfort zone to do what I like to do. So self-care, it's not one size fits all strategy. Your self-care plan will need to be customized to your needs. So keep calm and make a self-care plan. What do you do to cope with stress? You can do a lot of things: mindfulness, music, skiing, hiking, biking, I don't know, walking, a lot of cooking, a lot of things. Shopping. And personally, I would like to make fishing. And also, I would like to tell you, cheers, to go out and take some dinner with friends and beloved people. So cheers. If I have time, I can ask you what do you like to do to respond in one word. I don't know, Berta, if I can.
Yeah, sure. They can
Yeah,
respond
please,
in one word.
let me know what you can do to cope with your stress. Let me know, please. Somebody write something.
We have Svetlana saying dance, which I share. Liyam, I go walking, exploring, martial arts, hiking, boxing, jiggle with my girls. I go spend time with those I love, singing, drink coffee with someone.
Yeah, it's tailored for you. And you, Berta, what do you like to do?
I love dancing and live concerts, music in general. It's very therapeutic.
For example, Carmen go for boxing. She asked me to go with her. I told her, this is punishment for me. I cannot do boxing, but I like to do something else. For example, I like to go for dinner, for example, like ping pong, something like this. We have to do what we like to do. And now I will end my presentation by a quote from Maya Angelou. She says, as you grow older, you will discover that you have two hands, one for helping yourself, the other one for helping others. So giving the world the best of you to spread the light everywhere in your home, your work, your community, and to give your client the chance to see the light and to feel the light again. Thank you.
Thank you so much, Sana. That was, I think, everyone loved your presentation if you look at the chat. And now we have some minutes for reflection.
I'm happy to hear that. Thank you.
Anyone who wants to share? Carmen says, thank you for, sorry, go ahead, Sarah.
Thank you, Sana. I think that the small things that we are doing in our daily activities can turn into a resource to manage stress. And there is something that many times we tend to forget, because it's part of the routine, it's part of your daily activities. And if you take your daily activities, such as doing a house chores, it's important to do in changing your mind. Not only because you need to do in your place, it's because it's your time. It's exclusively for you.
Thank you,
and using this as a mindful time for yourself.
Yes, thank you, Sarah. I agree with you. Forget some time to think about ourselves and about our well-being because of stress of work and everything. To be honest, I had passed a lot of burnout during my life and during my work, but I cannot stand like this. But when I make checklists, daily checklists, what let me feel happy, I'm grateful for what, for example, when I listen to my patient told me about gratefulness, for example, their hope, for example, to liberate their country. Then after they see a countenance to, for example, somebody let them be free, then they hope to have sandwich of falafel. Then they hope to have hands to eat with because they put their hand. They feel the what we call the blessing of everything. So I learned from my patient. Now from Gaza, people are angry. Children are hungry. They cannot eat. They eat something like, I don't know why, maybe Khadr can explain for us about this issue. For sure, I have to be grateful about what I live for. We should make comparison between us and other people, between us and our beneficiary, between us and refugees. So we can feel that we have something we can live for. And our cause also, it's very good to stand with our cause. I don't know if I answered your question, Sarah. And I felt from the beginning that you are affected also by your patient.
Yes, I'm a survivor working and supporting survivors, so I can feel the work in my person, and I can feel what the client is bringing to the center.
Yeah,
that's why
learn
it's
also from
self-care.
your experience and our experience. Yes, sure.
Yeah.
Yeah.
Well, if there are no more reflections, I'm just being mindful of the time because we have the last speaker, Mechthild Wenk-Ansohn. She's a psychotherapist specialized in psychotraumatology and former head of the Ambulant sector at the ÜBERLEBEN Center in Germany. So, Mechthild, if you're ready, the floor is yours, and I can share the screen if you prefer that, or maybe
I
you can
try to do so.
Sure, do that.
With my techniques. I will try to share mine. Okay, fine.
Exactly.
Yeah.
And I just want to mention any questions and comments that I can see in the chat. We can take them, feel free to write them, and we'll take them at the end. Yeah.
Come on. Okay. But just, I think everything has already been said. But I think we need a small rest in between. Like sometimes also when we work, we have to rest in between just 1 minute. So I would like to invite everybody just to get up from the seat and get up and just stretch a little bit, like a cat in the morning, stretching and breathing in and breathing out and stretching in the other direction, breathing in and out, and to feel the feet on the ground and to see what is in the room. Maybe you like something, what is in your room. Okay, so then, of course, you have to sit down again, and I will also have some slides for you, and then we can discuss, hopefully, still.
That was great.
Yeah, and maybe also when you sit down now, you can also roll your shoulders, roll it up, roll it to the back, because often when we concentrate, we have, such tensions in the muscles of the neck and the shoulders, and that's not good at all, and it makes headache also. Not only burnout makes headache, but also when we just, stay in one position all day because we have to work so much. I will try to wrap it up a little bit, what we have already heard. You see, okay, of course, there is the work with the topic and with the target group, with the torture survivors or with refugees who are traumatized. And we are in a society, in a certain context, and sometimes the context is very hard, like now it's in Gaza, or it's in Ukraine, but also like here in Europe, sometimes the context is difficult because, people say refugees have to get out, and our clients have a difficult life here. Yeah, so we have the context of society, and okay, we are working in an organization, and this is very important that we are not alone. We are working together with others, and the organization has a certain mission. And as Carla has been mentioning in the beginning, it's very important, the organization, yeah, so that there is a certain policy for staff care and also for emergency situations, and that there is a good structure and transparency. And I work in a lot of organizations as supervisors, and I don't know why it is so difficult to have an appreciative management and CO. I don't know. It's just horrible. Yeah, and then of course you have your team, and I think it's very, very important to work in a team, to cooperate in a team, to have shared values in the team, and also to have clear procedures of work, and that these procedures have been elaborated together in a participative way. Yeah, and we, of course, we have learned a lot today. And thank you, Sana, also for these many ideas for self-care. It was so great. And your comics, I like them so much. Yeah, and so we have always to ask ourselves, on which level is my actual main stressor or the main stressors? Is it in the organization? Is it in the team? Am I doing not enough self-care? Is it in the situation when I'm working with clients? And then, yeah, I have to see, okay, what could I improve? And you really have to analyze this because it's very individual and it might be different in different times. And then you see what can be improved. The strange thing was that when our former head of the service, Christian Pross, he made in IRCT centers some research and came out that it was not so very often that people had vicarious trauma or even PTSD. But a lot of people were very frustrated and burned out. And he said at that time, he found that in the organizations, often it is like unlimited tasks. And of course, the injustice in the world is endless. And when we look at this time now, it is really endless and horrible. And we, the human rights defenders, we have high moral demands for others and for ourselves. So the trouble is our aims are never achieved, and I feel that we have not done enough. And as we have seen before, our colleagues already mentioned it, the workload exceeds personal and financial resources, and often the donors do pressure because numbers, you have to work with so many victims, and then the management has these pressures, and the management passes on the pressure to the field workers. Yeah. So you try to do as much as you can, but then you take no time for team care and so and self-care. So this maybe belongs to something which you also can call rescue motivation. You go into self-sacrifice and workalism. There might be very much pressure from outside, but often I think the pressure comes from inside. So what Christian and colleagues saw that, yeah, it is very, very important, this clear structure with an authorized leadership, but this is the leadership, the leaders need not only to have professional knowledge about how to work with torture survivor, but also to see what is my task as team leader. And I think that Carla mentioned a lot of good things, and that really the leaders and that they need training before. I don't know what happened. Berta?
Yes, I think I thought you were meaning to share your screen, so I shared it for you. But I'm not
No,
sure if you
I
wanted to
was
share. You
sharing
don't
my
want to share.
screen. I was sharing my screen.
No, we didn't see it. That's why I tried to do it
Okay.
myself. So, but maybe you can try again. I didn't want to interrupt you.
No, but then you share the screen.
Okay, perfect. And I will try to follow your as you present. Yes.
Yeah. Disculpe.
No
Yeah,
worries.
okay. No? So go to the next one. No, we were here with this image that, you know, the whole world rests on our shoulders and we have to save the world. Okay, then the next one. The authorized leadership and the clear roles and responsibility. And it's very important also in the onboarding that it is there is enough professional training, and that the leadership also supports that you maintain boundaries, because it's not easy to maintain boundaries. Next one. Yeah, this is also such a model as Carla showed us before. We have been doing a project together with IRCT and together with Antares in Holland some years ago for European centers. And I think it's just important to have in mind, it's not, you know, staff care is not just self-care, and it's not just preparing in the beginning, but that training should be all the time. There should be a monitoring, and support should be ongoing all over the time and in crisis situations. But also, I think at the end of assignment, because some people really are hurt by this kind of work. And we have to see if the project is over and the person cannot stay in our team, that we see that the person goes out in a good way and has care if she's needed. Next slide. Okay, I think we have seen the risk factors already, also with Sana. I just want to mention that the danger to be affected is very high also when we work with children who are affected. And I think when we are working with children, we really need the colleagues to debrief, and we need external supervision, especially. Yeah. And then one thing I think which is also sometimes a problem is that there is a lack of support networks for referral. Yeah, that you have a place where you can send clients to if they have very hard mental issues, or if they are suicidal and so on. So I think when starting a work, we have to be looking for networks. Next one. Sana already mentioned, no? This drama triangle, victim, therapist, persecutor. And I think it's something we have to reflect always when we are working, that we are in danger to get over identified with our clients. The thing is that to work as counselor, you have to have empathy. If not, you have no relation. And then the thing is that you start over identifying. So I think this is also something very important we are working often on in supervision. Next slide. Next slide. I would like to say some words on supportive supervision. It was already mentioned various times. And because we are training supervisors and working as supervisors, just to know it's a safe and confidential space. And it is not something where the supervisors is up there and telling you what to do, but it is a reflection together. And it's a reflection with your team or with colleagues and a mutual consultation. And it can focus on cases, but also on stresses at work. And it can be individually or in a team or in a group. And the best thing, of course, is face-to-face, but often it's online. Next one. Okay, so external supervision is done by a professional, external, experienced and specially trained facilitator. It is, I mean, there is also supervision like technical supervision, or you have supervision after training with a certain method. But we prefer to have the access to external supervision because there you can just openly talk about the challenges you have and on an eye-to-eye level with your colleagues. And it's something along the work life. It's not just in the beginning. You can be very, very experienced, but still you will have challenges. And intervision, on the other hand, is something where you are in your team or in your organization and talk in a structured way with your colleagues. Next slide. Yeah, so what we want is good care for the client. We want to enhance the quality of the work. And at the same time, we reach a professional growth of the caregivers, that they have also the feeling that they are owning what they are doing, that they are part of it. And we want to care for the caregivers, and not once, but continuously in the organization. Next slide. So we are doing trainings with the method we have learned by Johan Lansen and Ton Hans. Sana has mentioned it. No? It is trauma and culture sensitive, and it's very participative. And it's school overarching. You can come from any school, and depending on the focus, of course, you have psychodynamic elements, especially when it comes to the drama triangle and to the relation, the counseling relation, but also with systemic elements where you see the family, where you see the resources. And it's highly structured in several rounds and gives a safe space. And it can be adapted also to working in different context situations. And also the basics of the methods can be adapted to do organizational counseling. Yeah, and we have done some training, Nora and I, a colleague in Georgia, Ukraine, North Iraq, Egypt, and it was very nice. We had the chance to do two trainings with Syrian professionals in Gaziantep, Turkey. And now we have 38 trained supervisors, and we have done a TOT so that they can just work themselves and train other people. Next slide. And it's a long training because it's a profession. So it's almost 40 days. And the first year is to become an intervision facilitator, to work inside the organization. And then the second year is to become an external supervisor. And yeah, it's something long. And this is why, of course, it is not easy to get financing for it. But at the moment, we are trying to get financing for maybe a series of training in the Philippines. And we also hope that if other people from the IRCT are interested, that they say hello to the secretary, and that we can do so, because I think it's a good way to have a deeper level of staff care and care for the work. And yeah, it also implies a lot of self-awareness. This is why it's so long. So I'm grateful that it was mentioned already that this is an important element of self and staff care. Okay, so next and last slide. Yeah, it is just asking you, what do you see on the photo? It's an exercise for mindfulness. Anybody puts it in the chat?
Not yet.
What do you see? You can just open your mic and say something.
Liyam says still water, lily pads.
Yeah.
Clarissa says a very calm lake.
Yeah.
And William says turtle.
Yeah. Yeah. Yeah, you saw the
Reflection.
turtle. Yeah.
A mushroom.
Yeah, you see in the middle, nah? Where the wood is, you see a little turtle, and she's so cool because she's lying in the sun, she's joyful, and she's not afraid at the moment. But if something comes, she just can hide, and she has her house and her safety shield with her. So this is what I'm wishing all of you, that you also have joyful moments and care for yourself to be safe to continue this work. Thank you.
Thank you so much, Mechthild. That was a good way of ending the session, and also it's good that you took it from what was already presented. It was really nice, Mechthild. I don't know if we have 2 minutes to close, but maybe we can take an additional one if there are any reflections or questions, last quotes.
Yo muy breve.
Dale, Andrés.
Me parece muy importante lo que Mechthild le está tocando, de aprovechar del online, de las posibilidades, donde hemos podido ver obligatoriamente que puede funcionar muy bien, que sea supervisión, que sea un trabajo con una persona de autoconocimiento. Eso nos da mucho más posibilidades de apoyo a nivel internacional. El segundo punto, yo no sé si me escapó, Mechthild, pero lo que me parece importante que la formación de supervisores, de mi punto de vista, necesitan haber hecho un trabajo prealable de autoconocimiento.
Sí.
No sé si está incluido.
Sí.
Ya.
Sí.
Gracias.
Sí. No, inicio, in the beginning, it was not included because here in Germany, we did often this training. And then we had like therapists who had to have some time for self-awareness, and self-experience. And then when we came into the other countries, like in Iraq or in with the Syrians now, they have had short trainings in something and they were working so much, but they had never had this chance to have self-experience. And it was very challenging for us because also our supervisors often had gone through own traumata and own replacements. So we had to be very careful, but it is a very important part.
I'm seeing Clarissa. Sí, Clarissa, if you want to jump in.
Sí, muchas gracias a todas las panelistas por sus interesantes contribuciones. Me parece bastante interesante esta experiencia que nos comparte Mechthild, no sé cómo pronunciarlo, Mechthild, sobre la capacitación para personas que ya estamos en el área trabajando. Quería, si nos puedes profundizar un poquito en cuáles son los resultados cuando hay un trabajo al interno del grupo, o sea, que alguien del mismo grupo facilita estas terapias, estas sesiones.
I just can answer that. I think intervision is very important, and often you have access to external supervision more seldom, and then you do intervision, but it's also good to train somehow the intervision facilitators, to have two, for example, in the team. But it's not easy because they don't have this perspective from a little bit far away, and they are part of the team dynamics and of the organizational dynamics. So it is important, but I think at the same time, it's very important to have access to external supervision and reflection.
Thank you, Mechthild and Clarissa. I know there might be many more reflections. We're always limited on time, even though we made it 2 hours. But I think this is only the beginning of a lot of work and discussions at the RCT. So we're gonna have to leave it here with Lisa's last words. And at the same time, I will be displaying a post survey on your screen. You know, these 3 questions. So yeah, you can go ahead, Lisa.
Excellent. Yeah, but thank you very much. And I think all the speakers really gave amazing inspiration, some ideas that we at ICRC would very much like to, hear even more opinions from you on, because we feel and are sensing and also hearing today that there's a need to do more of this. And we as an organization standing for what we do should be well equipped with evidence base to go to some donors and talk about the need for this. So therefore, I'm really pleased to hear about, this also from an organizational perspective. This is not the responsibility of the individual caregiver or receptionist, financial officer, right, social worker on the team. It isn't. This is an organizational responsibility. It's also a personal responsibility. But there are techniques for, I think, approaching this, from the bottom up and also from the top down. And I think it should be simultaneous, to be honest. One of the biggest challenges I hear is, and especially from, younger people working in this community, there's always something more we can be doing. We're not doing enough, right? I need to save the world. We need to be doing more. And I think we have to be able to message that, working with one client and their family is an invaluable impact on this world. Praise yourself for that. Experience that as success, So there's something about, volume. There's something about burnout rates. There's something about the organizational perspective, supervision, obviously, intervision, great techniques that we've learned about here. So I would like to thank you very much for sharing your experiences with us today. And I will end by saying last night we were participating in the VAST Canada Scientific Symposium. And one of their partners working in Syria and working with refugees there was describing self-awareness classes and wellness and safe spaces for kids. And it was yoga classes. This is not something, people laugh a bit, oh, yoga, what's that all about? If it's consistent, you keep coming back to it. You're teaching people practice where they can actually sit for an hour of time and really, think about what's going on with themselves, relax their body, and then equip themselves for the day ahead. These are small pieces, but I think they're pieces of a big puzzle. So thank you very much for staying with us and contributing your invaluable info. And you'll be hearing more from IRCT. I really think this will be a part, not to tell the whole secret right away, but I really think this will be a big part of our strategic work as we move forward. Thanks very much for your time. And any other feedback you send to Berta? Over to you, Berta.
Yes, no, thank you, everyone. I see a lot of positive messages on the chat, which is really nice, and craving new conversations. That's really nice. Yes. Well, thank you, everyone. Let's say bye for last time. Bye-bye. Bye, Jader. Bye, Sara. Bye, Cajoe. Bye, Mechthild.
Bye, Berta. Thank you
Bye,
so much.
Sana.
Bye.
Thank you so
Bye,
much.
Berta.
Thank you so much. Yeah.
Bye. Bye, Mechthild.
Bye-bye. It was so
Happy
nice
to see you again. And bye, Liyam. Bye, Lisa.
All the others.
Lisa, you are a very good model to make balance between your professional and personal life.
Yes, she is.
I have seen this. I
can say.
I noticed.
Okay.
That's why
I'll do private courses.
You should teach us all.
That's why IRCT is in good hands.
Yeah.
Exactly.
Sana, you're too generous. Thank you very much.
Thank you for you.
Thank you,
everyone. Good job, folks.
Bye-bye.
Nice teamwork.
Bye.
Nice teamwork today. Ciao.
Bye.
Meeting verlassen.